Good evening, ladies and gentlemen. My name is Joanne Bartholomew, and I'm pleased to welcome you all to Kirklees Council's webinar for the community, voluntary and third sector, where we want to talk to you about the lifting of restrictions and what that means for you as community groups. I've got some colleagues here with me today, so I'll ask them all to introduce themselves. Emily?
Hi everybody, my name's Emily Parry-Harries. I'm a consultant in public health and I'm Head of Public Health for Kirklees Council, and I'm very pleased to be with you today.
Thank you, Emily. Jane?
Hello, I'm Jane O'Donnell, Head of Health Protection in Kirklees Council.
And Mark?
Hello there everybody, I'm Mark Farmer, I'm the Chief Executive of the Yorkshire Children's Centre and I'm also here as a trustee and board member of TSL.
Thank you, Mark. And Jill?
Good evening everyone, I'm Jill Greenfield, Service Director for Communities and Customers at Kirklees Council.
So everyone, for those of you that have been here before, you'll know the format. If you want to ask us a question, stick it in the chat and we'll make sure we get to it. But we've already had some pre-questions. Those of you that are watching this on YouTube after the event, if you've still got any questions and concerns, if you let us know, we'll definitely feed back to you. So what we're wanting to do today is to update you on the current position, share some ideas, and just recognise that actually, as we start to move into COVID recovery and out of restrictions, it's probably getting a little bit more difficult to understand what is the right thing to do as a community and voluntary organisation. So we're here to chat that through with you yourself. And we'll also talk to you about some of the changes that have happened with some of the government regulations. And luckily for us, they got published this afternoon. So that means we can actually talk with a little bit of authority, having had a tiny bit of time to read them before the 16th of August. The first thing though that I want to do is that I want to ask Emily to talk to us about COVID and where we are with vaccinations and give us any advice and guidance on that.
Okay, thank you, Joanne. So I'm just very quickly going to talk through some data, and I will share a link to our Tableau dashboard with my colleagues in comms, and they will make sure that that gets put into the chat on YouTube as well, so people can have a look outside of this meeting if you want to. So I think it's worth just making the point that COVID is still with us. It's still very real, and the virus is still circulating in our population. And Jane's going to talk in a little while about the things that we need to do from an infection prevention and control point of view. The vaccination story is a very positive one at the moment. We've got a good uptake, generally speaking, of the vaccine in our population, although we see some differences in uptake by geography and some differences in uptake by age and by gender as well. So generally speaking, the older you are in our population, the more likely you are to have taken the vaccine when it is offered to you. But that's also because those age groups have been eligible for the vaccine for longer. So I've had a bit more of an opportunity to think about whether the vaccine is the thing that they want to do, come forward and take that opportunity. So we're continuing to work very hard with our NHS colleagues to make sure that taking the vaccine is as easy as it is possible to be for our communities. And we're doing that through established vaccination sites, but also through pop-ups, going to music festivals, going into public spaces, etc. So generally a really good news story, and for the vast majority of our population, when they are offered the vaccine, they are taking the vaccine. We are still seeing levels of infection across our population. It's really important that we remember that the vaccine is about protecting the individual who is vaccinated from becoming very, very unwell. It doesn't necessarily stop you getting COVID, and it doesn't necessarily stop you passing it on to others. So we are still seeing a level of infection in our population that is higher than we would like it to be, which is why those hands, face, space and ventilation messages that Jane will talk about in a minute continue to be really important. Along with our increasing infection rates at the moment, we're also starting to see some increases in hospitalisations, and very sadly, we have had a few deaths from COVID-19 in the last week as well. So it continues to be incredibly important that people take the vaccine and follow those public health messages of keeping your distance and washing your hands. I'm not going to go into a huge amount more detail because I'll put the link in the chat and people can have a look for themselves. I think it's important that people use the data so that you can use that to inform the risk assessments that you're undertaking, but also to inform your own personal decision making as to what you do and don't decide to do. So I think in summary, there is still more COVID around in the population than we would like there to be. And it's really important that we continue to behave in a way that keeps other people and ourselves as safe as it's possible to be. And I think that's probably all I'm going to say for now, Jo, if that's okay.
Yeah, it is. But I would just like, I think it's probably useful as reminding colleagues in the voluntary and third sector how we publicise where people can go for vaccinations so that they can spread that word as well.
Absolutely. So again, I'll send a link over and we'll put it in the YouTube chat. There is a really comprehensive list of all of the pop-up vaccination centres and the non-pop-up, the established centres on our council website. So, and that's constantly updated as well because we are using the data that we've got to respond by putting pop-ups into the places where we're seeing the uptake not being quite as high as we might like it to be. So the council website is the place to look for that. We keep our Facebook and our Twitter, our social media feeds updated as well with where people can go to access their pop-up vaccinations. So yeah, I'll send the link over as well.
Thanks, Emily. And what I'd like to do is to ask colleagues that are watching this or either live or on the reruns to make sure that you pick those up. And if there's some in your area for you to get those messages out, we are very mindful that not everybody follows the council on social media, but those people in your communities for which your community asset or whatever it is that you do for your community will follow you, and you getting those messages out for us is incredibly important.
Absolutely. And I think there's something really, really important about how we talk about the vaccine in positive terms and how where people have taken the vaccine themselves, if you're able to and willing to talk to other people, because it's by understanding that people like you are taking it that we will increase the uptake in our communities. So yeah, absolutely.
Absolutely. Thank you very much for that. So Jane, you've got two things on the agenda. One is an update from August 16th, and then we're going to move on to some bits about what it means like to operate in that. So I'll move on to you. I do know though that the regulations only came out earlier today because we've been waiting for them. But what can you tell colleagues that are watching around post August 16th?
Right. So just to be clear, from the 16th of August, if you're a positive case of COVID, there's still that legal requirement to isolate. So I think we need to be clear about that one. There's, you know, if you're positive, you must continue to isolate. But individuals are exempt from the legal duty to self-isolate if they're identified as a close contact by NHS Test and Trace. But they have to meet certain exemption criteria. So you've got to be an adult who is fully vaccinated and you've had both doses, and your second dose must be at least 14 days prior to that contact with that case. And children and babies, so sort of individuals under the age of 18 years and over the age of 6 months, they're exempt from isolating as well. People are medically exempt from being vaccinated for medical reasons. Now we are waiting to obviously how that people would have to evidence that. That's not clear at the moment, Joanne, is what has come out. And my understanding, if I can remember, is also people who are on clinical trials as part of a COVID vaccine trial programme. Individuals who are identified as contacts are advised to take a PCR test. That is advisory. to make sure that they're not showing that they're asymptomatic, because as we know, some people are asymptomatic, they're not showing symptoms. Children under the age of 4 years, that's not advised unless it's a close household contact. Now, what it's also saying is if you can meet those exemptions, your PCR test is negative, then also we would be advising you that obviously you don't mix with people who are clinically extremely vulnerable, that you sort of limit contact with people in enclosed spaces. So again, encourage to wear a face covering and practice social distancing and good hand hygiene. And also do regular lateral flow tests as well. There's also guidance for health and social care staff, because as we know, prior to the 16th, there was exceptional circumstances where they didn't require isolation. Obviously, from the 16th, if they fulfil the requirement for double vaccination, they will not. There won't be a requirement again to self-isolate, but there's more in-depth detail for health and social care staff as regards the 16th of August. So I think that in a nutshell, that's what the guidance is saying at the moment.
And I'm feeling a bit better because I read it this afternoon, and I now know that I read it right, because what you just said is what I thought. But there's some really clear principles there, Jane, out there that are just worth repeating. The first one is, if you are positive, you must stay at home and isolate. There's no exemption from isolation. If you are positive, you must stay at home. If you are not double vaccinated, you must stay at home unless you are exempt from vaccination because you have a clinical reason, or you're within a clinical trial, or you're a child under the age of 18. So those are really clear guidance for people going forward, accepting that in some settings it's a little bit different in care homes around who should go in. But I think the other thing that we'd all want to say is, if you have been pinged by test and trace and you are negative, very much like Jane has said, do be mindful that that's negative today, not negative tomorrow, and be mindful about how you go about your business for the next few days and possibly week, so that you're ensuring that you're not bringing any sort of situations to other people that could cause them to be ill. And those kindness, it's part of that kindness things, isn't it? And being aware. Yeah. So those are quite clear now. And that gives us a framework with which everybody can operate going forward. And certainly it is part of the government's reopening, isn't it? So, in a careful and controlled manner, if you were pinged but you meet the criteria and you haven't tested, you can go about your business carefully, can't you?
Yeah, I think also, obviously, there's the difference between the NHS sort of proximity alert and actually the NHS test and trace. Getting in contact. And I think it's important to also say is if you are what the term people are saying pinged, which is the NHS alert, people, obviously that's not a legal duty, but it is advisory. But also I think it's people really thinking about where they've been within those 48 hours. It may be the fact that if you're not doubly vaccinated, and I've been to the nightclub, and so I've been sat, in close proximity, and then there's a different risk to that than actually you had a walk around a park area.
Yeah, there is. And some of this is definitely about taking personal responsibility for yourself, but also being mindful of the situations you place other people in by carrying on with your daily business once you've been pinged. So, yeah, but again, I think we've moved to a point where the advice is quite clear on this one. So Jane, with all that in mind, as we move into a world where there's no regulations per se, there must be some clear advice and guidance for groups, and I know we're using some as a council, around how you can reduce the potential for your setting to put people at risk. So what advice can you offer community groups around that?
Well, obviously, all community groups, you'll have a health and safety risk assessment, and as part of your health and safety risk assessment, you will obviously continue to include some of the COVID measures. So being obviously looking at hand hygiene, obviously increasing ventilation, obviously face coverings could be included, and also some people may want to still look at social distancing because there may be, individuals who are clinically extremely vulnerable. I think it's about being kind and considerate, really, and doing right by people. So it depends on each individual situation, really, but the risk assessment is paramount and extremely important. And I would also say as well that, doing the lateral flow testing as well continues to be so important as well, because we do know that so many people are asymptomatic.
Yeah, that is. I've got mine here. I did a lateral flow test before I went into the office yesterday. It started to be a little bit of a habit for me as I pack my PC up into my laptop bag, that I do a little lateral flow test and get my bits and pieces sorted together and then check it just before I leave. Part of that personal responsibility to make sure that people feel safe. I also I'm personally carrying a mask, and there's certain circumstances where I will put it on, but there are other circumstances where I would put it on if somebody else asked me to or appeared to be uncomfortable, definitely. And that's something I think that all settings can encourage. But there were some key points in what you said there, Jane, and my main fold, we're coming up to winter, so the ventilation bit has been really easy over the summer, particularly given we've had some incredibly warm periods during this summer. Having people have the windows open has not been too much of an issue, but it is about that changing the air in the building, even if that is between sessions and users, opening the doors and things, and letting the air change throughout that, keeping things clean and reminding people to keep themselves clean, and be conscious that not everybody else is comfortable with these types of circumstances. And you did mention a key thing at the beginning of what you were saying there, which was around health and safety and risk assessments. As we move into winter, who knows what winter will bring? If we all cross our fingers really hard, it might not bring any more resurgence of COVID, and we might get away with a mild level of flu, and we might not necessarily get norovirus or something else, but we might. And so people need to be alive to the fact that it's not, your risk assessment isn't okay forever, it's just okay for now. And if things change in your community or with the staff or the volunteers that work in your organisation, you might need to get your risk assessment out and go, does this feel comfortable now? Do I feel like I'm keeping everybody safe and doing everything I could be doing, or do I need to change what it is I'm doing? And we call it having a dynamic risk assessment, which is a very fancy way of saying every now and then you just have a look at it and see if it's still fit for purpose. Yeah, and I think we'd encourage people to do that, wouldn't we, Jane?
Certainly, yeah. I also wanted to mention just a little bit about the lateral flow testing, which might be more acceptable for people to undertake them. Is now they're moving on to where people can do just double nasal testing, because we know that some people don't like to do the nasopharyngeal, where you go to the back of the throat because they tend to gag more. So
yeah, I sound like a cat being sick, but I still do it. But yeah, I'm looking forward to just the nasal kits. Thank you very much, and I'm sure a lot of other people are, although it does make me sneeze. But yeah, that would be really, really good. I think it should encourage more people to do it. And certainly if you're a parent and you're having to do your child, it feels less like you're holding them down. Doing it, it might be a lot easier to do it. Are those distributed from out of the pharmacies now, Jane? Because I do know that there's different kits are coming through different routes, aren't they?
They're coming through pharmacy, they're coming through community collect, and also now via home testing, but it's at speed where stock from others has been phased out. So it's really until that becomes into that distribution model.
So So the key thing with that is to read your leaflet then, isn't it? Don't, just because you've had a lateral flow test pack box in the cupboard, assume that the next set of lateral flow tests you get are the same. Read the leaflet every time you get a set of kits. And you can probably just have a quick scan over it and go, yes, is it what I've done before? Or have I now picked up a set of kits that's just the nasal ones and doesn't need the tonsil swab? Jane called it a fancy word. I can't say that word, so we'll just go with the tonsil swab for now. Thanks, Jane. I think that's been really clear for colleagues. I do think we might get some questions about ventilation in winter and comfort levels, but we'll probably pick those up later. What I'd like to do though now, Mark, is turn to you because you're running a venue at the moment, and you've been running that since you've been back open since April, I understand.
That's
so
right.
Tell me a little bit about how that's been going for you, and if you'd sort of tell colleagues on the call what you're thinking of doing post April 16th.
Yes, certainly. So we run two community buildings, Brian Jackson House in centre of Huddersfield and also Joe Cox House over in Batley. For those who don't know it, they're mixed use buildings with our own employees in there, permanent tenants, but a significant amount of use by community groups that come and go and book space. So we've had to take into account regular users, but also, like many people on this call, groups that use it as a one-off or on an occasional basis. So I'd echo a lot of the comments that colleagues have already made, and I'd start with the risk assessment approach. So risk assessment of the COVID risk assessment's done way back at the beginning of the pandemic, when obviously things are very different, and we've kept that risk assessment alive and dynamic, as Joanne was saying. And as each government advice or guidance step changed, we went through the roadmap, we'd looked at the risk assessment and say, right, what's now appropriate going forwards? And we've also taken the approach that just because we're able to do something doesn't mean that we should do it. So obviously a lot of the restrictions that were in place have gone, but we didn't straight away say, well, that's great, we can go back to February 2020 and pretend life's back to how it used to be. So we've taken a cautious approach, and we've also said what is most appropriate for the buildings. And actually, we haven't taken the same response in both because of Brian Jackson House is a large building, it's quite a lot of circulation space. Joe Cox House is the opposite. It's a bit of a winding maze of a building with small corridors, etc. So I think it's really important for groups that are either using buildings or operating buildings that you think about all of those aspects. And so we've kept some core things in place and then made some choice. So we've kept in place additional cleaning regimes. So rooms are now cleaned, meeting rooms are cleaned completely after every use. We do them, as Joanne was saying, the doors are open, the windows are open, we get that circulation of air around. We leave gaps between meetings that we might not have done before. We've looked at the capacity of the meeting rooms and still promote the use of them based on a 1 metre social distancing. Clearly some groups are more comfortable with being closer than others, but our starting point is a reduced capacity. And I know a lot of our tenants, including Kirklees, are taking the same approach to office space. We've kept hand sanitisers in place. We've kept the information around the building about being kind, being considerate. If someone else is on a stairway, make sure that other people can pass. So the social distancing, giving space messages, and the sanitising messages haven't changed. They are the same as they have been for right throughout the period of the pandemic. We took a decision in our buildings that we would not make or would not keep face coverings as compulsory. We've made it a personal choice. We advise people to wear them. We suggest people wear them. And what we've actually found is probably about 50-50. About 50% of our building users probably walk around in masks, about 50% don't. But we also say in our messaging and when we talk to people is if you're in a meeting room or you're in a group that are using our building and there's someone in that group that has requested or would like others to wear the face coverings, you should be considerate and you should take their thoughts into account. And I have to say, so far, that's worked really well. We haven't had conflict on that. But where the difference in the building comes in, where we've got a much tighter space in Joe Cox House, we've left reception screens up. We've left more of the physical barriers in place, because actually maintaining space in a natural way is harder. Whereas where you've got a more spacious building, it's a slightly easier thing to do. And I think the other thing I would say is we've still kept all the messaging up around hand washing and all those aspects. If you go back to, as other colleagues have said, the space, face, hands sort of messaging, I think that's all still very appropriate. And I think that what other colleagues on these call and watching this call should take to think about for their either group or building is, what's most appropriate for you? What sort of group are you? Have you got clinically vulnerable people in your group? Who are your service users? Who are coming into your building? So when we have our dementia group in, for example, we might take a slightly different approach when we have another group in. Take that dynamic approach to it, and err on the side of caution. If in doubt, take a step back, put a little bit more in place, make people feel a bit more comfortable. So it's a fairly quick run through of the approach we've taken. And the other thing I'd say is we've tried to be very good at communicating it. So we've tried to make sure that our building users know as we've made changes, know what the situation is. And we're fortunate the buildings have receptionists, so they're able to answer questions. I know that's not always the case. But if you've got buildings that don't have that receptionist, I think having information you're able to provide to your building users is really important.
Have you found that staff and volunteers have felt around everything that you've done?
I would say that it's actually been a good process, and we've engaged people. We've asked for views and comments as we've gone. My view is that actually our building users, both our own people and our other building users, feel quite comfortable with where we're at and the decisions we've taken. But it is that communication engagement that's important. And if people have concerns, taking time out to discuss them, answer them, and if necessary, change what you do.
Yeah, I must say, Christine from New Mind Counselling Services, who uses Joe Cox House, has just very helpfully put a comment in the chat that says they're going to use the Yorkshire Children's Centre's risk assessment to base theirs on. So that's saying that people have got a real confidence in what you're doing there, Mark, and feel that's they've seen that evident in working for there, and so they're going to base their things on that. And I do think sorry, Jane, that's helpful to know. And also, Christine or anybody else wants any of that information, quite happy to provide it through. I think all of this stuff is learning from each other, and certainly that's the whole point of third sector cooperation, TSL's approach, infrastructure approach, help each other, support each other. And if we've got things that have worked for us and people want to see what we've sent out, just get in touch and we can do so. And equally, we're always happy to learn from others as well. We certainly don't own all the good ideas. No, I don't think any of us do, because we live in unprecedented times,
Absolutely
don't we? And I know Lisa from Chestnut Centre, who was on one of these calls previously, is very clear about come and have a look. We can share our stuff, and I think that's the ethos behind third sector leaders, which is that together we can work through this and definitely come up with that. I think one of the key points that you've mentioned is that there is not one answer, and so we've moved out of a phase where regulations gave you an answer that there must be 2 meters between you and another person. And we've moved into a slightly trickier phase, I think, for voluntary and community groups, as well as people in life, where people have to actually think about how does this work? There's a lot more thought needs to go into things, and that does mean that occasionally we'll put something in place and that won't be quite right, and then the next day we'll put something else in. But that's a learning process, and I think it's really good that you've left your hand washing things up, because colleagues on the call, particularly Jane and Emily, would say not getting norovirus or flu in winter will be dramatically reduced. You see, I do listen. If you keep washing your hands and things. So good hand hygiene.
I used to be a director of John Ambulance, and one of the first things we used to teach people on first aid courses was how to wash their hands. And And so now I'm sort of a couple of years later, and you see that's why we used to teach people how to do it.
It was very, very interesting at the start of the COVID pandemic that we could look at other data, and Jane will nod at this, I'm sure. We could look at other data and see a real drop off of norovirus, of diarrhea and vomiting, because people were washing their hands better. So this is not just advice for COVID times. This is advice for life generally. Wash your hands well and frequently, and it will contribute to you not being ill.
We have actually seen an increase in
and
gastrointestinal infections since the listing of restrictions on the 19th.
Yeah. I never realised before just how long it should have taken me to wash my hands, it has to be said.
Absolutely, and I think that
but I'm well versed in it now.
That we are seeing the rates of norovirus and the like starting to go up is evidence of the fact that people are already not doing it as well as they had been doing previously. So I've lost count of the number of times I've told people to wash their hands over the last 18 months, but I'll do it again. Keep washing your hands. It's really, really important.
Yeah. So I'm going to move on to Jill now, and then I'm going to start to take, because we've got questions coming in thick and fast. But Jill, you wanted to talk to us about council support for community groups. But I think one of the first things that both I and you would want to do would be to thank community groups for the real sense of community throughout all this, because we wouldn't have delivered without them, would we?
No, absolutely, Joanne, and it is a massive thank you, because it wasn't just during, when restrictions were here. Our community groups have continued and still continue to step up and really support local people in all sorts of ways. And I think, that's where I'd say in terms of our support, we work very closely with our community groups and third sector partners who offer an enormous raft of that support already, and we work closely to make sure that that we don't duplicate, and that we make sure that the people who can offer support are enabled in the right place to be able to do so. So I mean, in terms of the council support specifically, we do have a third sector team that again can support you generally around policy, health and safety, as well as signpost grants. We do also have locally, you'll probably know some of your local democracy officers, again, who really know the patch, and they can also be that conduit to council support. And we also have, again, in partnership, our Community Plus service as well, who can again have those conversations with you and make, if you do want to ask about certain things about your activities or opening up buildings, they'll be able to, if they don't know the answers, they'll certainly be able to link you into some support, whether that be from, people on this call today, third sector leaders or other council officers. So we will make sure that we share those details. And of course, there is the community champions that we've worked really closely with our community partners and our VCS partners, and have I think it's nearly over 100 community champions now that can also help you get out some of those health related messages as well. So please do make use of your community champions. Again, I can put out in the link, as Emily had referenced earlier, we can put out a link to the council support, third sector team Community Plus, where we can talk about access to grants and other ongoing support. I mean, a lot of people are really well connected. If you're not, please do make contact with third sector leaders or ourselves, and we'll make sure that you're connected to whatever support we can provide. And just to reiterate what Joanne just said, it is astounding the amount of work that has happened and continues to happen. And there are a number of ways that we all connect in. So please do keep doing that connecting, because there is always more achieved through collaboration.
Absolutely,
I think that's it.
Jill. Absolutely. And I think one of the things for me is that we've created real strength of the community in areas where it wasn't previously, and we've showcased some real community organisations that are exemplars across Kirklees, whether they were doing food bank or support for vulnerable people, and we wouldn't want to lose that, would we? We wouldn't want to lose that capacity and that sense of neighbourliness and caring for other people, because undoubtedly in non-COVID times, those have an absolute benefit to how people live their life and the quality of life in each individual area. So yeah, we will share those community champion details that you've talked about, Jill, because I don't think we can overshare that, because I am conscious that some of the questions on the chat this time are from organisations, this being our 4th or 5th of these that we've done, that I haven't seen. So every time we reach different organisations, it's worth reminding everybody about that. So we've got some questions in the chat, but we had some pre-questions, and it's one of those I'm going to turn to first, because I think it's quite a fundamental overarching question, which is, some groups are finding that they've got pressure to hire out their space for large gatherings. Can they say no if they feel not ready? So this is really a question I'm probably going to turn to you, Mark. So if somebody wanted to do something in your building, which is perfectly within the realms of what you're allowed to do in society, but you didn't feel it was right, what would you do and how would you approach that?
Well, first of all, it's up to each organisations as to how they use their buildings. So the easy answer to the question is, can you decline a booking or inquiry like that? Yes, of course you can. The longer answer is, you need to think about, as I said earlier on, what your views as an organisation, other use of the building. Are there other people in at the same time? Who will come in afterwards? How would it be cleaned in between? Because no use for building is in isolation of everything else. It's always a before and after and a during. Are you able to cope with the extra cleaning that would bring in? Does that put anybody at risk by doing that? Are you needing to service that group in any way that would put your staff or your volunteers at risk, in your view? At the end of the day, I think it's the view of the organisation that are being asked, which is the most important one. Certainly, we, as I said earlier on, we are promoting the use of our spaces with a reduced capacity. If somebody came to us wanting a full capacity, we'd have that conversation. We wouldn't necessarily say yes or no. We'd have that risk assessed conversation. An example I can give is, for those who know Brian Jackson House, is a very big space down the basement. That's used sometimes by very large groups, 150, 200 people. That's all working on reduced capacity at the moment. And I think we would be unlikely to accept a full capacity booking because of the cleaning and the other requirements that would bring in. So are you able to decline that? Of course you are. Just think about why you're doing that. And if it's because of impact on other users, impact on your employees, impact on your volunteers, and you think that is a risk that is too far for where you as an organisation currently are in your thinking, it's perfectly legitimate to have that conversation with the inquirer and look for another solution.
Yeah, I think that the key in everything that you've said there is about that conversation, isn't it? Throughout the next few months, well into winter, we're going to be having lots of conversation about how comfortable one person is versus another person in a set of circumstances. And having had lots of conversation with staff and colleagues, you get people on this end of the spectrum and people on this end of the spectrum. And if you're operating a community resource or a venue, you're trying to operate somewhere in the middle where you're keeping everybody as happy and engaged as you possibly can, as well probably recognising that you've been through a difficult financial period. There is definitely something about how we need to make sure that continual conversations. So why do you want this event like this? What can we do? How can we work around that? How can we engage? If you moved it to a different time frame, would we feel more comfortable? So if this was post Christmas, as not pre-Christmas, that conversation is really important. But ultimately, the answer is, if you're not comfortable with your venue or your community organisation being involved with something that in a particular way, It's absolutely within your gift to say no to that. So with another question, with another set of questions now, I'm probably going to turn to Jane and Emily first on, which are about face masks. One is, how do we encourage people to wear face masks? And one is, when you get conflict around face masks, and I'm certain we've all seen it out in society, have we got any advice as to how people can resolve that, or what we could do to support people to wear masks?
I think it's the understanding of why we're asking people to wear a face covering. Really, obviously, it does protect. It does protect others. We don't know people that you may come into contact with, whether they're clinically extremely vulnerable, or they may have a medical exemption why they cannot have the vaccination. I think also it's ensuring that at times that we have some signage what says, you know, be kind and considerate. People may wish to wear a face covering. I think again it's having it's trying to have those conversations, or at least having some signage what actually in a way explains why.
We've got some really good signage in our libraries, I think it is, and I'm probably going to get this absolutely wrong, so I probably should have asked Jill anyway. I think they say things like, I wear a face mask to protect you. I'd be grateful if you wear one to protect me. Am I right, Jill? Have I got it slightly wrong?
No, we are looking at our own signage at the moment, and we were having this conversation the other day, wasn't we, Jane, about starting to pull together some templates. But that is definitely the approach we're taking. And we were talking about, there are some really good examples in supermarkets, and we are starting to pull together some that hopefully we can also share as well as part of this.
Yeah, and I do think if third sector and voluntary organisations perhaps wanted to still to be able to offer masks to people, because now more and more people are not using them. People are ended up in situations where they haven't got one. I do know we still have a small stock of PPE which we could support third sector organisations with some face masks with, couldn't we, Jane?
Yeah, and I think with any behaviour change, and this is essentially a behaviour change programme, isn't it, that we are trying to encourage people to do a thing that keeps themselves and others as safe as it's possible to do. Modelling that behaviour is a really important part of it as well. So if you are wanting people to wear face coverings when they come into your building, having the person on reception wearing one, having your staff members wearing them as they move around the building, because people will see that and go, oh, okay, so that's how I'm being expected to behave in this setting, and are therefore more likely to either remember that they've got one with them and it's in their bag and they just need to bob it on, or to try and get one or bring one with them the next time. So I think it's about being really consistent in the behaviours that we are trying to support people to undertake. So wear your face covering will influence other people to do the same.
And I think putting those 2 points together, having them available at reception is important.
Yeah.
So making sure you've always got some. So if you're trying to encourage people to wear them, or they come in and they want to wear one, as you say, because more and more people now won't be carrying them because they'll just get out of the habit. And so having them available, I think, is important.
Absolutely. And I think building on, I can't remember who made the point earlier, I'm sorry, but there are certain circumstances in which I will definitely wear a face covering. I will wear a face covering if I am in a confined space with people that I don't know and don't routinely live with, because that's about keeping them safe. I'll wear a face covering if somebody else asks me to, because it's part of how they are made to feel safe and comfortable, because it is the kind thing to do. And I will do that in combination with all of the other things that we have in our COVID toolbox to reduce the spread of the virus. So I think I've shared on this conversation before the Swiss cheese diagram. So if we think about all the different slices of Swiss cheese and trying to make it so that the holes don't line up, that's why we are using a whole range of, to use a fancy term, non-pharmaceutical interventions to support the reduction in the spread of COVID. So hand washing, wearing a face covering, ventilation, maintaining social distance, not being in a space if you're symptomatic, and treating isolation very seriously are all part of how we make those holes not line up and reduce the spread of the virus.
Thank you, Emily. Yeah, but and if there are any groups who need a bit of support with any stock of any PPE, if they get in touch with us, we might be able to give you a small starter stock to help you feel that you're opening up in a way that supports what you want to do as an organisation. So there are a couple of questions around risk assessment templates and templates for signage, and we can absolutely definitely share those. And if there are any organisations who feel that they've got this really cracked, who want to be able to offer other organisations to go and have a look round and walk through those buildings. I know previously we had a number, Chestnut came forward for colleagues to go and look round. So please, if you feel you're doing this really well, shout out and we'll signpost other organisations towards having a look round you. We've got a couple of questions now about lateral flow testing, if I might, which is around, can we ask people to take a lateral flow test before they attend our venue? And I think the answer to that is we can ask, but we can't make. I'm correct, aren't I, Jane?
Yeah, we can encourage.
Yeah, and that might be about you having a stock as well, you know, so they are freely available, the lateral flow test kits and for people to have, and it might be about you just having a box of those that you can share with colleagues or signposting them to where they are. And again, they're available at most pharmacies. We've actually got a collect site outside Huddersfield bus station and one in Batley Town Hall where you can go along and collect test kits from those. So yeah, the answer is you can request people to do it, you can ask them if they've done it, and they can tell you they have, but there's no mechanism for you to check that in this particular context. And then following on from that, there's a question around vaccination and can we check whether people are vaccinated? Can we ask? What do we do if they don't tell us or they're not? So again, it's a very similar answer, isn't it? Jane's nodding, but I don't know if you want to come in, Jane or Emily, on this one.
Yeah, we cannot ask people if they've been doubly vaccinated. Going forward with the exemption to self-isolate, that information will be made available to the contact tracers, who will be able to see if somebody is doubly vaccinated. But we cannot ask somebody if they've actually taken up the vaccine.
I think, so if I'm just jumping, I think that's both of those points also apply to our own volunteers and our people as well. You know, we encourage, and I'm sure other people on this call do the same, encourage employees and volunteers to take the lateral flow test. We've encouraged, obviously, in the early days to the vaccination, and we've pushed that through. But we can't make people do it, and we don't keep a record of who does it either. So it's almost putting back onto people's self-responsibility, but making all the encouragement noises. And obviously, when it comes down to our own people, making sure we give them time if they need time to be vaccinated, etc.
And I want to bring Emily in because I think sometimes we want to know if somebody's been vaccinated because we think that keeps other people safe, and it doesn't in reality, does it, Emily?
Absolutely. So it's about, the vaccine is about the impact on the individual. There's some evidence that it reduces the spread of the virus a little bit, but the main point is about reducing the impact on the individual. And reducing their risk of becoming really unwell. I think it's really important at this point as well. And Mark, you were talking about encouraging people to take the vaccine, and we still need to be in that space of encouraging people. Just because people have been eligible for a little while, it doesn't mean that they're not eligible anymore. The NHS talk about this being an evergreen offer of the vaccine. So if people have been thinking about it and now feel that they are in a space where they want to take the vaccine, the vaccine is available to them, and it will remain available to them through the life of the vaccination programme. So if there's people sitting on the call today, or if you know people who have been umming and ahhing about it, they've not been sure, and they really did just want to wait and see that lots of other people had had it and they'd been all right. Well, we are now in the position where lots and lots and lots of other people have taken the vaccine and they have been all right. So if people are now feeling more confident and want to come forward for the vaccine, they're absolutely able to. I think sometimes people have thought, okay, so because of the way we were doing it, where the older population were eligible first, and then we've moved down through the age groups, people have sometimes thought, well, they've done my age group, so I've missed my chance. No, you haven't. Absolutely, if you want to come forward for the vaccine is there for you to take.
Yeah, and as we said previously, if you follow our social media, and we'd be grateful if you'd retweet it, there isn't a day goes by without a different pop-up clinic offering vaccinations, and probably some right in the heart of some of the communities that the people watching on this this serve.
Absolutely, we've gone to a lot of effort to make sure that when we are putting pop-up clinics into communities, it's in spaces where people go to anyway, so that it's, so that somebody can walk past a pop-up and go, do you know what, I'm in the space now where I'm ready to do it. They can walk in, there's no need to book an appointment, and you can take the vaccine. So we're trying very, very hard to make it as easy as we possibly can for people. There are still opportunities to book an appointment and to visit an established site if that's how you would prefer to take the vaccine. But for other people, there is the opportunity just to bump into it as part of their daily lives and take the vaccine.
Absolutely, really important for us to remember with that encouragement stuff. But the key message out of that is that you can't ask for somebody can volunteer that they've been double vaccinated, but you can't use that as a screening mechanism as to whether people can or can't engage with things. Obviously, as Jane indicated, post the 16th of August, that your vaccination status does impact on whether you do or do not have to isolate in certain circumstances, but it's not for anything else. I've got a couple more questions to go through, so it's my last call to anybody who's watching to get typing in your question. And I know that we've done that on this call, but I think it's really worth a quick recap round everybody of what do you think is the key thing from your perspective. And I'm going to let Mark go first, and then that'll make Jane and Emily think a little bit harder. So from your perspective, Mark, what do you think is the key way you're making everybody feel safe in your venues?
I think it's taking into account that people have different views, different needs, different requirements. Not everybody's in the same place. Keeping those core things around hygiene, the cleanliness, the sanitation, the hand washing, etc., in place, and not doing anything that would make people feel uncomfortable. So don't create situations, whether it's the large meetings we talked about earlier on, or anything else where people may feel uncomfortable, and listen. And if people feel they'd like to do things differently, or feel that we should adjust what we do, listen, take heed, and put their request first.
Thank you, Mark. Jane?
I would say keep your risk assessments live.
Yeah, and that's really timely actually, because Christine's just put in the chat, if somebody says they're happy to return to face-to-face, how can we mitigate the risk to them? And is it just hands, face, space, air, keep yourself clean? Yes, yeah, it is. If that person
cleaning. Yeah.
And cleaning, if that person is comfortable in that context, Christine, absolutely. But that's part of dynamic risk assessment, isn't it? That's what you're doing with that individual, is saying, how do you feel comfortable? How do the people who see you feel that you're comfortable with them? It's all the time reassessing that. Emily, what have you got? Anything you can add?
God, it's tough going last, isn't it? No, I think Mark and Jane have made excellent points. I think Christine's point about hands, face, space, ventilation, incredibly important. The only thing I would add is two things. if you have been vaccinated and are able to talk positively to other people about your experience of being vaccinated, don't underestimate how much that encourages other people who've been perhaps hesitant to take the vaccine. So I will talk to anybody and everybody about my experience of being vaccinated and why I will take the vaccine. So actively encourage people to do that if you feel able to. And then the other point is about testing. So again, if you are able to talk positively to people about your experience of using the lateral flow test, Joanne's shown you hers. For some reason, I feel it necessary to keep all of mine in a little box on my desk, and I've got piles and piles of them. So talk positively about your experience of lateral flow and PCR if you've had to go down that route, because this is about how we create a normal, and that actually it just becomes part and parcel of how you do it. So talking positively about the vaccine, talking positively about testing, and actively encouraging people who are symptomatic to not come into your venues, because that is part of how we reduce the spread of the virus.
Thank you, Emily.
And wash your hands.
Wash your hands. You always have to say wash your hands, don't you? So I'm going to turn to Jill for just a few words before I wrap up. Jill, is there anything that you want to say from a community perspective that we can offer the groups, or do we just want to keep signposting them where we've been signposting them?
I think we just want to keep signposting, really, Joanne, and I think just to make sure that you do talk and that we do have conversations, because that's where we get to understand, isn't it? If there are any problems, if anybody's resistant, if everybody's worried about anything, well, that's the space we can do something about it if we actually keep talking. But yeah, keep talking to us, keep signposting to the resources that there are. Our community resources and VCS sector are just brilliant, so let's keep using.
and I think what we'll do is we'll offer to have another one of these in about 6 to 7 weeks time, so that people can say how they're finding it, because I think different parts of the district will feel things are very different. Okay, so all that's left then is for me to thank Emily, Jane, Mark and Jill for their time here this evening. I hope you've all got your questions answered. If you haven't, do get in touch. Remember, this is not a period we're going into with a set of hard and fast rules. This is about just doing what feels to be the right thing for you and your organisation at this point in time, and refreshing that every now and then so we move forward. So thank you, everybody. Stay safe, take care, and remember, always be kind to each other, because we don't half live in interesting times. Good night.